Hi, I'm Dr. Edwin Williams. I'm a board-certified facial plastic surgeon and rhinoplasty specialist. Welcome to one of our Fireside Chats. The topic of conversation here really is what is the cost of rhinoplasty. It's one of the most important parts of the decision. People always want to know how much does a rhinoplasty cost. So I thought I'd take just a couple of minutes to explain. The first thing, there's usually three components to the fee. There's the surgeon's fee, there's the anesthesia fee, and the operating room fee. Now, the anesthesia fee is typically in the range of $500 to $700, depending on the amount of time the doctor uses. And then there's an operating room fee. In a surgery center, the operating room fee tends to be less compared to those in the hospital, and that's why we have our own accredited operating rooms, because it's just a little more economical for the patient. And then there's the surgeon's fee. The national average, according to 2016 data, is somewhere around $5,000. Now, how do you determine the fees? And typically, when you're looking for a rhinoplasty surgeon, the fee will be based on a few things. One of them has to do with the number of years in practice and the experience of that doctor. Is that doctor a leader in their field? Do they teach rhinoplasty not only at the university, but a national and international level? And what you'll tend to find is that those doctors with the most experience, their fees tend to be just a little bit higher. The other thing that factors into fee is the geographic area and market. For example, we have a clinic in the Albany, New York area, and our fees there are lower than they are in the New York area. So if you're in New York metropolitan city or San Francisco, you will find that the fees, even with the same amount of experience, tend to be a little higher for those doctors that are a reflection of, malpractice, overhead, space, etc. And then there's some speculation. There are some doctors who've done a really good job marketing themselves on the internet to create, just like a wine. You can overpay for wine. You can also overpay for rhinoplasty. There can be some very experienced surgeons that are a little less than someone who has done a really good job on marketing. The other thing that factors into the cost of rhinoplasty is whether it is a primary or secondary, what I refer to as a revision surgery. A primary rhinoplasty is less risky and less demanding and takes less time for the doctor to do. But yet when we get into revision surgery, especially if the doctor needs to harvest rib cartilage or ear cartilage or septal cartilage to redo, to help rebuild the nose, those procedures tend to be more lengthy and are more costly, and also there's more risk involved. And then the last component really comes down to, is this a minor tip revision kind of thing, or a minor tip work, or does it consider doing a full rhinoplasty? And I think that's something you should talk to your doctor about, because typically a minor procedure is tip work, for example. Just tip work alone, which is really not all that typical, ends up being less costly than a rhinoplasty where the bump is involved and there may or may not be breathing issues or concerns. So I hope that answered some of your questions on what is the cost of rhinoplasty. We have a book that we wrote that's available on Amazon. All the proceeds go to domestic violence. It's called Everything You Need to Know About Fixing and Reshaping Your Nose. And I will tell you, there's pretty much every question in here that's answered. The frequently asked questions, what's the post-op period like? I specialize primarily in the endonasal or scarless approach, which I think is much less traumatic for the patient, is a little bit more technically demanding and requires a great deal of expertise. So again, I hope I answered your questions, and thank you for listening.